You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Our guest is Dr. Rudrani Banik. She is the impresario, the impetus behind an upcoming Eye Summit, which is something that the public can participate in. It's going to be a real smorgasbord of information from experts about various aspects of eye health, both from the nutritional and integrative side, as well as the high-tech side, so you can find out what your options are in terms of various conditions and also just for general eye prevention. So Dr. Banik, my impression is that we're experiencing an epidemic of dry eye. Dry eye is becoming ever more prevalent, or is it just simply we're paying more attention to it? Something's going on here, right?
Yes, definitely. There are lifestyle factors at play, nutritional factors at play. So dry eye disease used to be something that we'd see in older individuals, typically women, postmenopausal women. But now, I would say in the past 10 years or so, I've really seen a shift where anyone can get dry eye disease. I even see dry eye in teenagers, young adults, even children. And probably our habits have something to do with it, being on screens, not blinking enough, but also air quality and, of course, diet. I think so much in the eye care space boils down to inadequate intake of certain nutrients.
So that's very interesting. The way that I used to address it nutritionally is with essential fatty acids. Is there evidence that essential fatty acids can be beneficial? Because I saw one study that I think was in New England Journal of Medicine, was kind of meh about fish oil. Fish oil,
yes.
Not so helpful. So, but my experience is that fish oil can be helpful, especially when it's teamed with GLA from borage oil, primrose oil, or things like that. Is there some evidence that works, and has that been your experience?
Yes, so there definitely are conflicting reports. I will say first and foremost, the initial studies looked at dietary intake of these fatty acids. Mm-hmm. And we absolutely know that dietary intake is critical in the management of dry eye. So fatty fish, at least 3 times a week, absolutely. Now, when it comes to supplementation, this is when it gets a little bit murky because the study that you mentioned in the New England Journal of Medicine, that was called the DREAM study. I don't know the exact, all the parts of that acronym, but dry eye, I don't recall. But basically, they looked at DHA and EPA, and it was a relatively low dose, less than 1,000 milligrams combined. And they compared that with their quote unquote placebo, which was not really a placebo. It was actually olive oil.
Yeah, see, that's the problem with some of these studies. And this often happens with heart health. They use too low a dose, and then they compare it to the comparator is olive oil, which might have benefits in itself, so that there's not a statistical difference. Where they really scored big is the pharmaceutical industry proved that their fish oil was helpful, and their placebo was mineral oil, which is not only not beneficial, but may actually be bad for you. It may absorb some of the essential fat-soluble vitamins. So they were smart. They used the right placebo to show a statistically significant difference. So it's interesting. Yeah, that study I think should not put to bed the notion that omega-3 could be beneficial. when deployed either from a dietary source or at higher doses.
Absolutely. And to your point about other omegas, so we always think about DHA, EPA for many benefits, but also GLA, which is an omega-6, by the way. It's an anti-inflammatory omega-6. That's been shown in several smaller studies to be beneficial for dry eye as a supplement. And also omega-7, which is not so commonly found, but palmitoleic acid, which can be found in macadamia nuts. It can be found in sea buckthorn oil. And most people don't have that on a regular basis, but
I think they sell it as a product called Fatty 15, I think.
I believe it's with some other omegas, but
yeah.
yes.
Okay.
So all of those various omegas have shown benefits. So I'm a big advocate of diet first, but if you have gaps in your diet, then supplement. And if you're going to take an omega supplement, take a good enough dose. Make sure that it's not subtherapeutic what you're taking. So I typically try to push people towards 1,500 milligrams to 2,000 milligrams a day of combined omega. I like 3, 6, 7, and 9. 9, by the way, is oleic acid. So I think it's that range. Yeah. And then there was another smaller study that was just published maybe about 2 years ago, looking at other nutrients for dry eye disease. And specifically, not fatty acids at all. They actually looked at lutein and zeaxanthin.
Interesting.
So the macular carotenoids for dry eye. And they combined that with vitamin D. And so they found that combination also helped, which goes back to diet, because if you're getting these nutrients through diet, you're hopefully covering all your bases. But, there are supplements that have been shown to help as well.
Indeed. So when it comes to lubricating the eyes, a lot of the products that are available have certain preservatives in them. Could that backfire when it comes to eye discomfort?
Yes, and it's actually this the topic of artificial tears, lubricating drops, oftentimes hits the headlines because there are recalls periodically by the FDA of drops that are contaminated with various microorganisms that are obviously not safe to put in the eye. But to answer your question, Dr. Hoffman, BAK is a preservative that's oftentimes used in these eye drops, benzyl curium chloride, BAK. And it's used in many, many different types of eye drops, but it can be, in some patients, it can actually be toxic to the surface of the eye. It can really sting and burn and degrade the corneal epithelium. So if you're someone who has tried eye drops and you just, don't feel better taking them, maybe try a preservative-free formulation. And always check the FDA website. I think just 2 or 3 weeks ago, another set of drops were recalled because of contamination issues.
Yikes. Okay. Let's shift gears to another phenomenon that's occurring. So many people these days are taking GLP-1 drugs, and there is a rare eye disease that suddenly we've seen an uptick in, and is thought to be associated with GLP-1 drugs.
Yes. And we've talked about this on your podcast, I think a few years back, this rare eye disease. It is rare. It's a type of eye stroke. And not a stroke in the brain, which is a lot of where our vision center is located, but it's actually a stroke to the optic nerve in the back of the eye. And it is a long name, non-arteritic anterior ischemic optic neuropathy, or NAION for short.
Okay. So the fellowship was worth it.
It was worth it. Yeah. My linguistic skills have improved considerably after saying that very quickly over and over and over again. But basically, it's pretty rare, about 2 to 10 per 100,000 in the population. So it's really, for most people, probably have never heard of it, don't have to worry about it. But there are more and more reports coming out linking Now, not causation, but association between these GLP-1 drugs and this type of optic nerve stroke.
Okay, so hang on. Could it be that it's not the GLP-1 drugs, but the very people who need the GLP-1 drugs, people who are overweight, people who have metabolic syndrome, that they are more prone to nigh on? Or is there evidence that above and beyond the risk factors that they've had metabolically, that the GLP-1 drugs have a unique effect on the eye?
We don't know the answer to that. That's an excellent question. Is it an independent risk factor other than the comorbidities that these patients have, which is why they're taking the drugs?
Right.
We know that, as you mentioned, diabetes, obesity, but also sleep apnea is a risk factor for this optic nerve stroke, NAION. And now there is a class of these GLP-1 drugs, tirzepatide, is FDA approved in the US for obstructive sleep apnea. So here you have a drug that's being used for this medical condition to improve the patient's quality of life and decrease their other systemic factors, but it may predispose and I'm saying may because we don't know for sure yet, but it's associated with potentially a higher risk of this type of optic nerve stroke.
Okay. I have a good friend, and he happens to be a physician. And he's very overweight, and he's very unhappy about it. And I said, well, maybe you should consider a GLP-1 drug. And he says, but I don't want to go blind. What would be your advice to him about that? My
advice is don't panic. Don't panic about these drugs. It's pretty rare, still pretty rare. Go see an ophthalmologist, preferably a neuro-ophthalmologist, get a baseline exam. Look at all of your risk factors because the drug is not the only risk factor. If it is a risk factor at all, again, we don't know for sure, but there are other things. There's the anatomy of the optic nerve. So if someone has an optic nerve that is on the small side, we call that an anatomic disc at risk or a crowded optic nerve. It's just the way they were born. They have a smaller nerve. They may be predisposed to this type of eye stroke. So if you have that, if you have sleep apnea, if you have extremely high blood pressure or low blood pressure at night, which is what we call nocturnal hypotension. These are all risk factors for optic nerve stroke. If you have something called optic dysdrusen, which are these calcium deposits that can happen in the optic nerve, you're at higher risk for NAION. So think about all those risk factors and then have a discussion with your doctor. How many of those factors do you have?
Right.
And then whether this class of drugs may be beneficial for you for, other reasons. And what's the risk-benefit ratio? And have that discussion.
So paradoxically, though, GLP-1 drugs could be beneficial for the eye because they correct metabolic problems. They may bring blood pressure down. They may bring blood sugar down. They may ultimately have an impact on the inflammatory cascade in the body because if you have a lot of adipose tissue, excess, visceral fat, you're going to promote inflammation. So it's kind of like you say, a risk-benefit equation, right?
It's truly a catch-22, right?
Yeah.
But what I would say is, there are other medications that can be used for metabolic control. There are other, for example, for diabetes, there are quite a few other medications that can be used for diabetic control. Weight loss, there are other ways to achieve weight loss, whether it's through diet and lifestyle, or there are other medications that can be used for weight loss, or in the worst case scenario, if somebody really needed weight loss, then there are surgical options as well, bariatric surgery, which I don't like to recommend, but if someone really needed it, and they can't take one of these GLP-1 drugs, then maybe that's an option. So I think it's really important to have your team come together and make a joint decision rather than unilaterally saying, I shouldn't be on this drug because I think I'm going to go blind. I think that may be a little bit too premature.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up. You know that feeling. You're exhausted, but your brain just won't quit. You're staring at the ceiling, watching the clock, dreading the morning. here's something that actually helps. It's called Kyolic Specialty Series Sleep Mushrooms Plus. And it's unlike anything you've tried before. This isn't some chemical sleep aid that leaves you foggy and dragging the next day. This is a clean botanical formula built around certified organic reishi mushrooms grown on real farms, not in a lab, combined with valerian root to help you fall asleep faster and stay asleep longer, L-theanine to quiet that racing mind, and Kyolic aged garlic extract, one of the most trusted wellness ingredients available for circulation and stress support. It's vegan, non-GMO, no gluten, no dairy, no artificial anything. Just 2 capsules, 2 hours before bed, and you wake up actually rested, not groggy, not out of it, just refreshed. Kyolic Sleep Mushrooms Plus from Wakanaga. Learn more about this and the entire Kyolic Mushrooms Plus line at kyolic.com. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online. Thanks for listening, and thanks for supporting our sponsors. They are what make intelligent medicine continuing free resource to you. And now, back to today's guest, integrative ophthalmologist, Dr. Rudrani Banik. So let's jump from, lifestyle measures to the opposite end of the spectrum. Some of these really cutting-edge procedures that actually will restore vision for people who even have an advanced eye disease. And you'll be talking a little bit about that, or some of your speakers will address that at the Eye Summit. Stem cells, there's gene therapy, there's an expensive drug for a certain type of eye problem. I hear it costs $850,000 per year. But it's not for everyone. It's for just a niched kind of macular degeneration. There's retinal implants. Elon Musk is working on, all these new devices that can restore our senses.
I think ophthalmology has always been a very exciting field. It is very technical. We use a lot of instrumentation. We use a lot of technology, a lot of imaging. Surgically also, we use a lot of instruments that are very precise. And so I think that these therapies that you mentioned, some of them are FDA approved and some of them are not. But I think that the technology that we have available is only getting better. And, whether it is through gene therapy, which is now FDA approved for very specific, as you mentioned, very niche retinal issues, I think it will be expanded to include more issues. Perhaps not just hereditary optic diseases, but other diseases as well.
So how does the gene therapy work? It's a little bit like if you have a, quote, faulty gene that somehow leads to a metabolic problem that robs you of vision, you can in some way insert the functioning gene, and by some means, through some vehicle into the eye or into the system, systemically or directly into the eye, and then it fixes the glitch.
Yes. And so actually I was involved. I was the principal investigator of the first gene therapy trial in eye disease in New York City.
Oh, wow.
This was around the time of the pandemic that we were doing this trial, but it was for a very specific hereditary optic nerve condition called Leber's hereditary optic neuropathy, or LHON. We love long terms in ophthalmology, but specifically neuro-ophthalmology, but LHON for short. And basically, the problem was due to a mutation, a single mutation in a mitochondrial gene. So not the cell's average gene, but specifically a mitochondrial gene that's carried through along the maternal line, because we get all of our mitochondrial DNA from our mothers. But basically, this hereditary eye disease would cause blindness, one eye, then the other eye. Typically, it affects young individuals, specifically males. So young men would come in with vision loss. And so the gene therapy was to replace that mutation with the quote unquote correct or wild type gene, mitochondrial gene. And the way it was delivered in the clinical trial is as you were alluding to, it was actually delivered through an eye injection, in what we call an intravitreal injection, in which the corrected gene was delivered through a viral vector. So an
Adenovirus.
adenovirus
Yeah.
vector. So
Okay.
AAV was the vector that carried the gene into the eye, was injected, and
In
then
effect, you infect the cells in the eye with that gene.
yes. And this virus, it doesn't have the ability to replicate.
Right.
So they've modified the virus so it can't replicate. So it can't cause
It's
disease in
simply
your
a carrier. It's
body.
just a carrier.
Exactly. So people were concerned about that, but in terms of the safety, it was safe in that respect. But yes, the thought is that the virus infects retinal ganglion cells, and we actually don't even know how the cells take up the virus with the gene, but people showed benefit. Our patients showed benefit, and so far the study, it is sponsored by a French company. And we have to do one more clinical trial before it gets FDA approved. So there have been 3 clinical trials thus far to establish, number one, safety, and then secondarily efficacy. But now they're requesting one more trial. And the reason that we need to do the 4th trial is because this is very interesting. This disease typically affects both eyes, but one eye was injected in the study, but the other eye also showed benefit. So the
Ooh,
FDA wanted to know
interesting.
if you inject just one eye, is that sufficient, or do you actually have to inject both eyes to
Interesting.
get the most benefit?
Okay.
And that's why it's gotten delayed, like the FDA approval. But I think later this year in 2026, we'll be starting this new clinical trial. And hopefully we'll have the answer, and hopefully this gets FDA approved.
So people with ordinary macular degeneration, the most common kind of age-related age-related macular degeneration, they should not jump the gun on this, because that is a multifactorial degenerative condition. It's not just one gene can repair it, but maybe there is some potential for some combination therapy to perhaps assist with repair in that condition, and that may be coming down the pike. That certainly would be the holy grail of treatment of age-related macular degeneration.
Yes, and actually we have a few speakers on the summit who are talking about AMD, and one of the speakers is Dr. Johanna Seddon. She's a leading researcher out of University of Massachusetts. She's really one of the pioneers in AMD management as it relates to nutrition and lifestyle. Her first paper was published back, I think, 1994, looking at nutrition.
Wow, that's really early, because I think there was the first papers on macular degeneration like 1992 with Craig Newsom at LSU. So she was really at the very inception of this understanding of how nutrition can support the retina.
And she was truly a pioneer because, she had to get her own funding. This was not funded by the NIH or any pharmaceutical company.
Who bought the formula, basically, and now sells their macular degeneration formula.
That came later. That came much later.
They sell an AREDS formula, it's called,
AREDS, yeah. Her work is incredible. So she's sharing that, and she's continuing to do this research. But I'll share this really important statistic with you and your audience, Dr. Hoffman. Dr. Seddon showed that if you are in the highest quintile intake of lutein and zeaxanthin, those 2 macular carotenoids, so if you're in the top 20% of intake, you can reduce your risk of macular degeneration progression by 43%. Cut your risk down by 43% simply by eating more foods rich in lutein and zeaxanthin. That's incredible. That's better than any drug on the market. That's better than any technology on the market to prevent vision loss. So that's really the mainstay. And since then, she's shown that even if you're on the trajectory of vision loss, even it's never too late. If you start to implement these changes, lifestyle, nutrition, you can still reap the benefits. Even if you have the genes that put you at risk for macular degeneration, you can still benefit. And I think her message is very powerful. And really, I'm honored to be able to have her be part of the summit, because she's such an esteemed researcher and just incredible insights into this this disease.
What's interesting is that many fields of medicine are only kind of a day late and a dollar short when it comes to implementing nutrition for care. And I'm thinking of, unfortunately, cardiology, and I'm thinking of, oncology and gastroenterology, but more and more they're looking at nutrition as potential preventive and even a treatment path. Ophthalmology was very early to the party when it comes to understanding that nutrition makes a big difference in eye health.
Yes, and you mentioned earlier the AREDS, which is a supplement formulation. There were two studies, the AREDS and the AREDS 2, that were sponsored by the NIH, probably also backed by Bausch and Lomb. I'm absolutely sure of that. But basically, they were really the foundational studies that showed that supplementation can make a difference in an age-related disease. And so really, it's been incredible to see this work kind of evolve. And I did hear that there's going to be an AREDS 3 in the works. So I'm looking forward to that. But I think, again, as an integrative ophthalmologist, my message to my patients, to my friends, my family, everyone, basically, and when I educate online, I say this all the time. If you supply your eyes with the right nutrients, you can prevent vision loss down the road. That's really the bottom line.
Yep, that is very clear cut. What are the foods that are most beneficial in terms of delivering high levels of lutein and zeaxanthin? And, perhaps also, I think the omega-3 fatty acids also, DHA especially, fit into that picture.
Yeah, so the top food by far, the highest concentration of lutein and zeaxanthin is found in kale.
Okay.
So kale is king when it comes to the density of these nutrients. Plus, it also gives you vitamin A or beta carotene, which gets converted into vitamin A. It gives you a lot of minerals, and it has a little bit of those omega fatty acids in it as well. But in any leafy green, so if you're not a fan of kale, any leafy green, spinach, arugula, collard greens, mustard greens, dandelion greens, Swiss chard, they're all amazing. But let's say you're not a fan of leafy greens, or let's say you can't tolerate them, or if you have an oxalate sensitivity. My next top food would be, now this may seem a little unusual, but orange and yellow bell peppers.
Oh, okay. Yeah.
It's the color of those bell peppers that is reflective of the lutein and zeaxanthin content, because lutein and zeaxanthin are a yellowish orange pigment. I mean, they have that pigment. So if you're at the grocery store, forgo the green bell peppers, even though that's probably what most people use. They're cheaper, but invest in those orange and yellow ones, because they will really support your eyes. And then there are many other foods like corn, for example. Of course, I prefer non-GMO corn.
I think the word zea means corn from zeaxanthin, in Latin or something. Yeah.
Yeah, zea mays actually is the scientific name for corn. That's where zeaxanthin came from the scientific name. Also spices. Now, I don't know exactly how much spice you'd have to get your highest intake level of lutein and zeaxanthin, but you can combine it with those foods. But paprika and cayenne pepper.
Oh, yeah, I love smoked paprika. I just had my eggs with smoked paprika this morning.
And egg yolk. Thank you for reminding me. Yes.
And last but not least, and this is what gets me, because these, there was this, I think we're a little bit over that. That ship has sailed on, eggs are bad for you, use egg beaters instead, make egg white omelets. Egg yolks are so nutritious and deliver, because of that beautiful orange pigment, they really deliver a benefit to the retina.
Yes, I tell all my patients, do not throw those yolks away. And beyond that, I mean, they're a great source of so many other nutrients, including choline, which is great for the eyes. So yes, and that's that beautiful orange color. That's, again, reflective of those pigments that our eyes need.
Okay. Well, this has really been a great sort of hors d'oeuvre for people who are thinking of attending the Eye Summit, because this is the kind of information you're going to get. and you're going to get it from authoritative researchers who are delving into all these aspects of eye health. And so once again, the website is theeyesummit.com. Is that correct?
Exactly, yes.
Okay. And, or you have a website, right, where you're talking about it, so people can go to your website. Where's that?
drranibanik.com. So drranibanik.com.
Okay, B-A-N-I-K, Dr. Rani Banik. And to those of us who know and love her, it's Dr. Rudy. Or Dr. Rani. Dr. Rani. I'm sorry, not Dr. Rudy.
Yes.
Dr. Rani. Yeah. So, okay, great stuff. Thank you very much. And, congratulations on putting this together. I think this is really going to be a service to the public. It's a really high quality summit with, not just, I think there's some people who are sort of dilettantes in this field, and, you can, influencers who talk about this, and, some are authoritative and some less reliable, but I think you're going to get some really, really high quality information out of this. So please attend the Eye Summit 2026. Dr. Banik, thank you very much for joining us, and really appreciate the work you do.
Thank you, Dr. Hoffman. Thank you for the opportunity for sharing all this information.
Indeed, and we'll definitely have you come back on, because this is a fast-developing field, and I'm sure that there are going to be some really exciting new innovations that you'll roll out for our audience when we next meet. So thanks very much.
Thank you.
I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. There were many important reasons why I started my FullScript online supplement dispensary. I wanted to offer you the same curated professional-grade supplement brands that I use, the ones I know and trust. I also wanted to ensure that they weren't counterfeit or expired. Recently, I've been hearing more and more about counterfeit or expired products purchased from online retailers. With FullScript, you can be confident your supplements are genuine and they'll arrive with optimal freshness and potency. Also, buying through FullScript offers fast, free shipping, optional refill reminders, and a highly rated mobile app. It's safe, secure, HIPAA compliant, and offers world-class support. Go to drhoffmanstore.com for more information and to start your free FullScript account. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. To get started, just go to drhoffmanstore.com, drhoffmanstore.com.